what brings to the fore is the fact that COVID-19 is continuing within the cluster in Labasa, in the family that have been isolated. We have been very grateful that this family has been isolated from as soon as the diagnosis was made, and the gentleman in Labasa was diagnosed with COVID-19. They have been in isolation since, and therefore the likelihood of further spread within this cluster is very low, as alluded to by the Honourable Prime Minister. But what it does mean is that we continue with our efforts to break that chain by making sure that we practice social distancing, making sure that we don't have mass gatherings, and as we have talked about, also making sure that we stay at home, as much as possible stay at home. What this also brings to the fore is the fact that this family have been interacting within themselves, and because majority of them have been positive, the clinicians and also the COVID-19 task force made the decision to test this patient, and this patient has become positive. On another note, I just want to let us know that the extensive comprehensive efforts of community screening has already begun in Suvavou. It began just before the cyclone. Certainly on the day of the cyclone they couldn't continue, but again it has continued again today. We have been told as of this morning in our briefing that about 6,000 Fijians in the greater Suvavou area have already been screened. So please allow the screening team to come and see you, and also visit you and your families, ask the relevant questions and take your temperatures. This is being done to make sure that we leave no stones unturned, that we also make sure that as the word has been used to flush out this virus from within the community. This has been done extensively in the Lotoka containment and Lotoka lockdown area, where nearly 60,000 Fijians have been visited and have had their temperatures checked and their history taken in their own homes. The same is also happening within the Suvavou area, and we ask everybody to support the work that government is doing with all its stakeholders and also the Ministry of Health. It is slightly disappointing to hear that there have been 6 families that have refused our Ministry of Health personnel to enter and also take their temperatures and talk to them as part of the screening program. Our health personnel have gone again this morning to talk to them, because it is important that we screen as much as we can. We also have to be mindful of the fact that under the Public Health COVID-19 Specific Act, there are powers and regulations given to the Permanent Secretary and the Minister for Health in terms of making sure that we protect the health of all Fijians. Is there any questions from the media?
Leader Momono from my TV, sir, good afternoon and blessings to you. Can you just tell us how many of patient 9's family members there were in the home they stayed in total before you took them into isolation? How many are now in isolation? And can you just confirm, it sounded as if you said these family members are still in contact with each other despite being under directives to quarantine?
What I've alluded to was the fact that ever since case number 9, the case in Labasa was positive, the cluster based out of Labasa, the third cluster, the family have been in isolation, initially at home, and then they were moved to the isolation facility within Labasa. As you're aware, everyone else in the family have become positive, and so the direction given and also the advice given by the COVID-19 task force was to test this young girl, and she is also positive, simply because of the interactions that happened before they were moved in to the Labasa Isolation Center. That's the probable cause. She is positive. She doesn't have any significant symptoms, but she is positive.
And what of his second son? Where is he?
So the second son lives, works in between Labasa and I believe also Suvavou. He is in the area of Siberia. in Labasa. They have been seen and regularly followed on a regular basis. They're in self-isolation. They have been tested at some point over the last few days. I can't remember exactly which day, and they are negative.
The family that you mentioned were refusing to be tested. Can you tell us a little bit more about this family and when, as you alluded to, you got powers under the Public Health Act and you did, as per past recently, to take action? Why haven't you done so?
You may have got that wrongly. This is within the Suva containment area as part of our efforts and comprehensive efforts to ensure that we, as the term is, to flush out this virus. Teams are on the ground going from house to house, beginning in particular suburbs, and going from house to house, asking relevant questions and taking temperatures. This is in addition to the fever clinics that we have. And unfortunately, as I've alluded to, there were 6 families over the last 2 days that had denied our Ministry of Health facilities the opportunity to do that. And we've gone back this morning to talk to them and explain to them that under the Public Health Act, specifically for COVID-19, we can do it so that we make sure that we are protecting the health of the nation as a whole, but also making sure that we're leaving no stones unturned in terms of the virus. Remember that at the moment we have a cluster of patients, so we have 4 clusters of patients. And you might be aware that in other countries, for example in New Zealand, they have 10 or more clusters that they are following. And it is important that we arrest it at those 4 clusters. The only way they can really be sure that there are only 4 clusters in this country, and that in the Suva containment area, there's only 1 cluster based out of the Lambasa cluster, is to do an extensive fever clinics or comprehensive community fever testing and discussions that's happening at the moment.
Dr. Maggie from FBC, if you could perhaps reassure people that in Suva, given that these mobile fever clinics are being carried out now, what will the personnel be wearing to ensure that they are from, in fact, the Ministry of Health and the district forces?
Thank you. All our fever clinic, mobile fever clinic staff have a form of identification. So they either will have the incident management team identity card or the Ministry of Health or Discipline Forces card. If they don't have that card, you're more than welcome to let us know. Of course, the helpline is there, 158, which you can call and let us know. Remember also that we want to make sure that this is not an effort to be exploited. So I'm asking those that want to exploit these efforts by using this opportunity to do whatever they want to do for their own benefit, to please don't do that. Because this is the matter of public emergency, and this is a matter of public health. I also want to bring to our attention the fact that this virus continues all over the world. There are now more than 1.6 or 1.7 million around the world that's been infected. And if we've been looking at what's happening around the world, the case fatality, those who died, have risen from 4% initially in January. It's now sitting at nearly 6%. So it is a killer. We do not send any more tests to Australia. All our tests are done at the Fiji Center for Disease Control up in Tamavo.
My next question is researchers at the University of specific COVID-19 conducting discussions in relation to projects that can use the wastewater system to track COVID-19 virus in regions in India asymptomatic. Can you please discuss some of the other areas that you are diving into to explore how you can respond to the virus establishment countries?
In terms of that research that you're talking about, that is something that we in the Ministry of Health are not part of, nor do we at the moment endorse that, because we are focused at the task at hand, which is to prevent the lives of all Fijians. Certainly as the data continues to come out regarding the patients that we have, how they're able to survive, if they get through this, what are the mechanisms by which we think they spread, because this will be data relevant to the Fijian setting. If you look at the Chinese, after the first 70,000 cases, they actually revealed a report, which has been quite helpful for all other governments and all other ministries of health in terms of their preparations. We have the opportunity to do that also. within whatever data that we have. But at the moment, we're not part of any research process or program or research topics or research that's happening with USB at the moment.
So we're Inoki with the Fiji Sun. So my question is, you mentioned that for the Greater Suvavou area, we are starting to conduct
community screening, mobile fever clinic.
My question is, now that we have another case with the cluster, the man in Mombasa, could you give us an update on the fever clinics in the northern area? How many people have been attending and how many people have been screened? And is the Ministry of Health also looking into establishing or conducting mobile fever clinics in the north?
Thank you. This week on Monday, sorry, I kept saying last because I think it's Sunday, because I'm thinking Sunday. But this week on Monday and Tuesday, our teams in the north saw all the 30 households or so within the Soso area. More than 400 Fijians were interviewed and tested. So far, none of them have been have been having a fever or need to be tested. We are intending to repeat that next week, but that's in addition to what's happening within the greater Lambasa area in terms of the mobile fever clinics and also the community reach moving throughout the greater Lambasa area. That will continue.
So with the local border restrictions been lifted, actually before it was, when it was imposed, there were satellite hospitals set up outside of Lotoka. Could you just give us some clarity on if the Lotoka hospital has resumed its normal service, or are they still being referred to the satellite hospitals?
So the Lotoka hospital has resumed its normal service. The Minister of Health has asked that those satellite hospitals continue for a little while so that they can be able to support within this transition period. Then after that, they will pull out from there. But as you're aware, these staff members are all from Suva. So obviously there needs to be discussion about how long it is, because remember, we're still within the containment period. Any other questions?
So, from the Fiji Times. Can you just give us an update on the condition of all the patients? I'm interested in the first patient, considering that today is his 21st day. Today marks 21 days since he was tested positive and diagnosed with COVID.
Yeah, thank you. Actually, for the first case, it's actually more than 21 days. All the patients are well. We've retested the first case, the second case, and the fifth case. So the second case is about 28 days, and the fifth case is about 19 or 18 days. They've all come back positive. So you can see that this virus lingers on for quite a period of time, despite the patients actually becoming well and asymptomatic. So they continue to be in hospital. They continue to be in hospital because they are positive. Remember that I've alluded to the criteria that we use is at 21 days to get a test. We've decided to test them earlier, just to make sure, just to see whether they actually become negative earlier. They haven't. So even at the 23rd or 24th day, it still is positive. So they remain in hospital until they become negative. Nabalu, thank you very much.